Welcome to Pathophysiology Part II. Here we're going to discuss factors affecting cell function. Disease or injury affecting the respiratory or cardiovascular system can affect the delivery of oxygen and nutrients to the cell and the removal of waste, thus disrupting homeostasis. Interruption of the body's oxygen supply and/or removal of carbon dioxide can lead to shock. Unless adequate perfusion is quickly restored, death may soon follow. The respiratory system delivers oxygen from the atmosphere to the blood, where it gets distributed to the body and removes carbon dioxide produced by the body's cell to the atmosphere. The patient must have an open airway in order for the essential process to occur. In addition, adequate oxygenation requires sufficient oxygen must be present in the surrounding air. Adequate movement of gases into and out of the lungs. Remember, we've talked about ventilation, mechanical inspiration and expiration, is dependent on an open airway and adequate rate and depth of movement of the thoracic cage by the respiratory muscles. Perfusion is the circulation of blood through an organ or part of the body. A balance between ventilating and perfusion must exist to ensure adequate gas exchange. Illness and injuries can affect ventilation and/or perfusion, disrupting homeostasis. For example, alveoli may be ventilated but not perfused, or conversely, alveoli may be perfused but not ventilated. Perfusion is the circulation of blood through an organ or part, just like we were saying. This will come up again. You will need to know this. A blocked airway or an injury or disease that affects oxygenation or ventilation can lead to hypoxia, which is a lack of oxygen, and/or hypercarbia, which is an increase in carbon dioxide. They're not mutually exclusive. Someone can be hypoxic without having hypercarbia. Somebody can have hypercarbia without being hypoxic. Particularly our patients with COPD, which is chronic obstructive pulmonary disease, they tend to retain carbon dioxide without getting they don't get the chance to put out that carbon dioxide, but they still have oxygen coming in. Possible causes of blocked airways include the presence of foreign body, the tongue blocking the airway in an unconscious patient, blood or secretions, swelling, or trauma in the neck. Even if the patient's airway is open, cell metabolism can be disrupted if there is inadequate oxygen in the air that is breathed in. Possible causes include a low oxygen environment, toxic gases, lung infection, infection or disease that narrows the airway and causes wheezing, excess of fluid in the lungs, excess fluid between the lungs and the blood vessels, or poor circulation. Wheezing is a high and low pitch whistling sound that is usually heard on exhalation. Wheezing suggests that there's a lower airway problem, and this may be from fluid, mucus, something along those lines. Let's see here. If the patient's rate of depth of breathing is not adequate, or an insufficient volume of air will be moved into and out of the lungs. Single respiration can consist of one inhalation and one exhalation. Normal respiratory rates depend on age. Tidal volume is the amount of air moved into and out of the lungs during a normal breath. Minute volume is the amount of air in and out of the lungs in 1 minute. Minute volume is determined by multiplying the tidal volume by the respiratory rate. Inadequate tidal volume or respiratory rate can result in inadequate ventilation. This in turn affects oxygenation and elimination of carbon dioxide, resulting in a decrease in ATP production, which is energy. And possible causes of inadequate rate and depth of breathing include disease, poisoning, overdose, chest injury, consciousness, or altered mental status. Perfusion depends on cardiac output, peripheral vascular resistance, and the transport of oxygen. Cardiac output is the amount of blood the heart pumps each minute. Cardiac output is determined by multiplying the stroke volume by heart rate. Stroke volume is the amount of blood ejected by the ventricles of the heart with each contraction. A change in either stroke volume or heart rate can affect cardiac output. The amount of blood returning to the ventricles is called the venous return. In a healthy heart, an increase in the volume of blood in the ventricles causes the fibers in the muscles to stretch, resulting in a more forceful contraction. This principle is known as Frank Starling's law of the heart. A decrease in the amount of blood returning to the heart and entering the ventricles causes less muscles, fibers stretch, decreased force of contraction, and decreased stroke volume. Hemorrhage, which is major bleeding, an extreme loss of blood from a blood vessel, is one cause of decreased venous return. Heart rates also affect cardiac output. If the patient's heart rate is too fast, the ventricles will have less time to refill before the next contraction. As a result, the stroke volume and subsequently cardiac output will decrease. In healthy individuals, a slow heart rate may reflect good physical condition. However, in many individuals, a heart rate below 50 will result in decreased cardiac output and reduced perfusion of vital body organs. Signs and symptoms of decreased cardiac output include restlessness, changes in mental status, fatigue, cold, clammy skin color changes, difficulty breathing, shortness of breath, changes in blood pressure, or abnormal heart rhythms. The walls of the arteries and veins are made up of 3 layers of tissue. The innermost layer, the tunica intima, is normally smooth, enabling blood to flow easily along its surface. Conditions such as high blood pressure, high cholesterol, smoking, and diabetes can damage this inner layer. The middle layer of an artery and vein is usually the thickest. It's made up of smooth muscle and sometimes elastic tissue. The amount of smooth muscle and elastic tissue varies depending on the vessel's function. For example, large arteries have a lot of elastic tissue, enabling them to stretch in response to the pumping action of the heart. The presence of smooth muscle allows the vessel to constrict, or narrow, and dilate, or widen, change the vessel's diameter. This characteristic plays an important role in regulating blood pressure and blood flow to various organs. The outermost layer, called the tunica externa or tunica adventitia, is often continuous with neighboring blood vessels, nerves, and other organs. This layer is made of tough tissue that protects the vessels, gives it strength to withstand high blood pressure, and provides a passageway for small nerves, smaller blood vessels, and lymphatic systems. Large arteries are called conducting vessels because their main purpose is to carry blood away from the heart through smaller arteries and capillaries to other body systems. The aorta, carotid arteries, and pulmonary arteries are examples of large arteries. The walls of large arteries are thick and elastic, allowing them to expand and recoil. When ventricular contractions occur, blood pressure rises and the walls of the large arteries expand. Blood pressure falls with the ventricular relaxation and arterial walls recoil. The elasticity of large arteries lessens the variations in pressure exerted in the smaller arteries. Medium-sized arteries, such as the brachial and femoral arteries, are called distributing vessels because they are farther away from the heart than large arteries and deliver blood to specific organs. Medium-sized arteries are primarily made of smooth muscles because they have less elasticity than larger arteries. The diameter of medium-sized arteries remains relatively constant with change in blood pressure. A medium-sized artery provides a greater resistance to blood flow than a large artery because its lumen is narrower. The smallest arteries, arterioles, are made of smooth muscle. They provide the greatest resistance to blood flow through the arterial circulation because the lumen of the arteriole is narrower than the medium and large arteries. For this reason, arterioles are called resistance vessels. Arterioles have a rich supply of fibers of sympathetic division and autonomic nervous systems and are primary sites at which the body controls the amount of blood sent to various organs. In most areas, the body blood from arterioles enters capillaries. Some arterioles connect directly to venules, which enables to bypass the capillary networks. The connections are called arteriovenous shunts. Capillaries, exchange vessels, are considered the functional units of the circulatory system because it is here that the exchange of oxygen, nutrients, and waste products between blood cells occurs. Capillaries are the most numerous of the blood vessels and are very thin, consisting of just one cell layer, enabling exchanges between the blood and tissue fluid. Capillaries form the extensive networks so that Capillaries form extensive networks so that few cells in the body are more than a fraction of a millimeter away from any capillary. Exceptions include tendons and ligaments, which contain few capillaries. Cartilage and the cornea of the lens of the eye contain no capillaries. A precapillary sphincter is a band of smooth muscles that is present at the opening of each capillary network. The amount of blood entering a capillary network and flowing to an organ is controlled by precapillary sphincters and the arterioles in the organ. Capillaries connect to venules, which is the smallest branch of veins. Blood is delivered from the venule into progressively larger vessels that empty into the large veins. Examples of large veins include superior and inferior vena cava. Veins of venules are called capacitance vessels because they function as reservoirs, stretching as they receive blood and return it to the heart. Peripheral vascular resistance, also called systemic vascular resistance, is the opposition that blood encounters in the blood vessels as it travels away from the heart. Because the resistance to flow in the venous circulation is very low, peripheral vascular resistance generally refers to the opposition to flow encountered in the arterial circulation. As previously discussed, the arterioles, because of the small diameter, are the vessels in the arterial circulation that have the greatest resistance to blood flow. However, changing the diameter of the arterioles alters the resistance to blood flow. For example, if arterioles widen, peripheral resistance is decreased, which means there is less resistance to blood flow. Widening of a vessel is called vasodilation. If arterioles narrow, peripheral resistance is increased, and there is an increase in resistance to blood flow. Narrowing a vessel is called vasoconstriction. Pressure provided by the circulatory system is required to move the blood that carries oxygen and other nutrients to the cells of the body. Blood pressure is the force exerted by the blood in the inner walls of the heart and arteries. It's affected by the cardiac output and peripheral vascular resistance, and can be expressed as blood pressure equals cardiac output times peripheral vascular resistance. Therefore, a change in cardiac output or peripheral vascular resistance will affect blood pressure. And that concludes Pathophysiology Part II.